Hello, my name is Lori Gill. I'm the founder and lead trainer of the Attachment and Trauma Treatment Center for Healing and also ATTACH Academy. We provide current quality trauma and attachment treatment training internationally for individuals, clinicians, and organizations in trauma-informed as well as trauma-specific treatment approaches. We teach people how to use our integrative trauma and attachment treatment model or our integrative trauma and attachment treatment model adapted non-clinical model. And our program is quite comprehensive and holistic in nature, focusing on mind-body neuroscience and somatic approaches to treating trauma. Our integrative trauma and attachment treatment model is a layered model that incorporates multiple modalities in a sequential manner to regulate the body, mind, and brain simultaneously. It's a rich and integrative approach with components of sensory processing, somatic therapy, art, resource installation, bilateral stimulation, integrative cognitive reframing, and sensory regulation work, to name a few components. Therapists around the world are learning the efficacy and power of this treatment model. And one of the best features for clients is that they don't need to talk about what happened. We have actively been using this treatment model at our two treatment centers, ATTACH Niagara and Lori Gill Psychotherapy, with great efficacy for treating complex trauma. It is a highly effective and accelerated treatment model for treating the underlying issues causing the pain, driving the addiction, the suicide ideation, the need to escape, high-risk behavior, etc. Using our integrative trauma and attachment treatment model, we observe clinically and statistically significant reductions to suicide ideation, tension reduction behaviors, so self-harm, addictions, high-risk behaviors, as well as depression, anxiety, and dissociation, to name a few. These are areas that often impact our daily life skills, education, employment, relationships, the ability to maintain safe housing and remain regulated, as well as the utilization of crisis and high-risk services. Results from the program evaluation of our model, completed by Victoria Dobson and Dr. Paul Fruin out of Western University Hospital, demonstrated clinically and statistically significant changes in these areas, often with observable reductions occurring in as little as 5 to 6 sessions. Now, that's not to say that everyone is fully recovered at the completion of treatment, as we are working with complex traumas, so there are no easy solutions. However, these are outcomes that are very realistic of working with a complex trauma population and demonstrate that there's a benefit to the treatment being offered. We work so much with people who experience suicide ideation and are living in recurrent trauma. And being able to get in there and treat the underlying issues that are driving the need to die, escape, binge, purge, harm, engage in high-risk behaviors can be absolutely life-changing. If you are ready to become trauma-informed or to enhance your trauma treatment, this training will help you learn an effective and efficient model for doing so. We have a wide variety of continuing education options that are also available. The Attachment and Trauma Treatment Center for Healing also offers custom trainings and certifications to meet agency, community, and practice needs. Because we're at a time right now where there's so much need and so much pain, my goal is to get this model to as many therapists and helpers as possible. Join us to learn leading edge approaches to treating complex trauma and promoting post-traumatic growth. Healing is possible, and it doesn't have to take a long time or be a painful process. Let's work together to help heal life's hurts and hearts.